As part of a new initiative, we are offering select patients the opportunity to go home on the same day as their mastectomy procedure. This is offered to patients who are having unilateral or one-sided mastectomy and are not undergoing breast reconstruction with plastic surgery. Several factors go into this decision, such as your overall health, weight, proximity to the hospital, and social support at home. Your surgeon will assess if this is a safe option for you. Once your surgeon has made a thorough assessment of your eligibility to go home the same day, if possible, it is important for you to appoint a family member or friend as your caretaker for at least your first night at home. Your healthcare team will arrange a visiting nurse as well to help you with drain care, pain management, and dressings. Your team will also make sure you have the phone number for the appropriate provider contact before surgery so that you feel well prepared in the event of an emergency. Your surgery will be scheduled for the morning so that we can allow enough time for monitoring you after surgery. You will spend about 6 hours in the post-anesthesia care unit, or PACU, and a nurse will be at your bedside to help you with your recovery needs. A physical therapist will meet with you while you are recovering to go through postoperative activity instructions and review helpful exercises. You might have surgical glue or steri-strips over your incision. Leave this on until it falls off on its own. You might be asked to wear a special surgical bra with gentle compression. This will be reviewed with you prior to discharge from the hospital. You may shower 24 hours after surgery, even with your drains. You should not take a bath or go swimming for 4 weeks, and your wounds must be completely healed prior to doing so. The mastectomy incision is usually numb. Do not use ice or heat packs on this area because it is hard to tell what is too hot or too cold, and you could damage your skin. You may take acetaminophen, Tylenol every 6 hours as needed. Do not take Tylenol with another medicine that has Tylenol in it, like Percocet, Norco, or Vicodin. Do not exceed 3,000 milligrams of Tylenol in 24 hours. Check with your doctor if it is okay to take anti-inflammatory medicines like ibuprofen, such as Advil, Motrin, or naproxen, also known as Aleve. If you take a daily aspirin, restart your aspirin after discussion with your surgeon. You will go home with a prescription for a narcotic medication to be used for breakthrough pain. Please refer to your teach packet for important guidance on safely taking opioid medication. Restart all of your medicines immediately after surgery unless you have been told not to. Walking is encouraged. You may climb stairs. Restart your normal daily activities when you are able. Slowly start to do more each day. You should not do any heavy lifting over 10 pounds for 4 weeks after surgery. You should avoid anything that involves pushing or pulling for 4 weeks after surgery. It is important not to allow your shoulder to stiffen up. We will provide exercises to work on as soon as you get home. You should start these as tolerated. Ask your doctor about getting back to specific exercises and sports. You may drive after the drains are removed, as long as you are not taking any narcotic medicine. Your PACU nurse will go through drain care with you while you are recovering. Your visiting nurse will also help with your drain care. You will need to strip the tubing 2 to 3 times per day. Empty your drains twice a day and as needed, and record the amount of drainage from each drain. Please call the office when your drainage is less than 30 cc's per day from each drain for 2 days in a row. Always make sure your drains are attached to your clothing or placed inside the pockets of your surgical camisole. Do not let them hang loose. Please also refer to our drain care video and instruction sheet for detailed information on drain care and useful tips on how to shower with the drains in place. As I mentioned before, your surgeon's office will ensure that you are set up with a visiting nurse to help you at home. He or she will help you with routine drain care, and postoperative teaching. He or she will also monitor the wound for any signs of swelling, opening of the incision, fever, or any other changes. When to call. It's important to call your surgeon's office when you have a fever higher than 101 degrees Fahrenheit, chills, redness around your incision, drainage from your incision, intolerable pain that is not controlled with pain medicine, increasing pain, increasing swelling at the surgical site, drain malfunctioning, such as drain not holding suction, or if drain output suddenly stops or rapidly increases, swelling down your arm or in your hand, and any other symptoms that worry you.